Every time you hold your breath to push through a heavy squat or, even just heave a massive bag of dog food into your car, you're actually sending this literal shock wave of internal pressure straight down into your pelvic floor.
Yeah, exactly. It's huge impact.
And we're constantly told to brace our core, right? By coaches, trainers, everyone. But nobody ever tells us that doing it wrong can physically alter our internal anatomy.
Welcome to today's deep dive. We are unpacking a super highly requested mission today. Can the way you brace your core actually impact your vaginal tone?
Which is such a huge blind spot in the fitness world today. I mean, we treat the core like a sheet of armor we just need to flex and harden, but biologically it's this super delicate, completely unseen system of pressure management.
Right, and to figure out what's really happening beneath the surface, we're pulling from a massive stack of sources today. We've synthesized urological data, pelvic floor physical therapy guides, clinical registries, and some really recent medical journals. Yeah, and the overarching theme across all this research is that when we mismanage that internal pressure, the consequences go way beyond just, say, a sore lower back or a failed deadlift. We're talking about long-term fundamental shifts in pelvic health.
Okay, so to understand how we're messing this up, we kind of have to throw away the idea that the core is just that front panel of abs, the six-pack muscles.
Right, exactly. If you want to know why pressure destroys vaginal tone, you have to visualize what the core actually looks like in 3 dimensions. And the clinical guides from Servue Health use this fantastic mechanical analogy. They describe your deep core as a pressurized soda can.
A soda can. Okay, so we're picturing a completely closed cylinder.
Exactly, a completely closed cylinder. So the top of the can is your diaphragm, which is your primary breathing muscle tucked up under your ribs. And then the cylindrical sides are made up of your deep spinal muscles in the back and a muscle called the transversus abdominis in the front.
Wait, just to clarify for everyone, that transversus abdominis, that's not the six-pack muscle, right? That's the deeper layer.
Yeah, it's the really deep layer that basically wraps all the way around your midsection like a thick corset. It holds your internal organs in place. So you've got the diaphragm on top, the corset around the sides, and finally, the bottom of the soda can is formed by your pelvic floor muscles.
Okay, so it's a bowl of muscles supporting everything from below.
Got it, right. And since it's a sealed can, any change in pressure inside that space obviously has to affect all the walls. And it's not a static system at all. It basically operates as a dynamic piston driven entirely by your breath.
So when you inhale, what happens exactly?
Well, when you inhale, your lungs fill with air, and your diaphragm actually drops down to make room. And that downward movement compresses the space in your abdomen, so the pressure inside the can increases.
That makes me think of squeezing a water balloon. If you press down on the top of a water balloon, the water has to go somewhere, so the bottom just bulges downward.
Yes. That is the exact biomechanical reality of breathing. I mean, to accommodate that downward pressure from the diaphragm, your pelvic floor actually has to lengthen and yield downward.
Hey, really? Every single time you take a breath?
Every single time.
So we're literally stretching and loading the pelvic floor thousands of times a day just by existing.
Yeah, we are. And then as you exhale, the diaphragm lifts back up into the chest cavity, the internal pressure drops, and the pelvic floor reflexively pulls back up to its resting position.
Oh, wow.
And this intra-abdominal pressure, or IAP, it's a completely natural, active mechanism of stabilization. It's what keeps your torso rigid enough to walk upright. Yeah. But it becomes highly destructive when that piston becomes dysfunctional.
Okay, so let's take this into the gym. We've got this delicate, rhythmic water balloon effect happening naturally. But what happens when we add, I don't know, a 100-pound barbell or a heavy jump rope routine into the mix?
Well, that is exactly where the system gets overwhelmed, because most people fundamentally misunderstand what it means to brace. They think it means just pulling the stomach in as tightly as possible.
Right, like sucking it all in.
Exactly. But if you suck your stomach in, you're artificially shrinking the sides of the soda can. You're basically squeezing the middle of the water balloon.
Which would violently force the pressure both up toward your throat and straight down into your pelvic floor, I imagine.
You got it. And if you combine sucking in with the most common lifting mistake out there, you create this perfect storm for pelvic damage. The real danger zone here is something called the Valsalva maneuver.
The Valsalva maneuver. That sounds like a terrifying roller coaster or something.
It does, yeah. But it's really just the clinical term for holding your breath and bearing down hard. It's when you breathe out forcefully against a closed airway.
Like that red-faced, vein-popping look people get when they're trying to deadlift their absolute max weight.
Exactly. Or even just the strain of a difficult bowel movement, that is a valsalva. You are taking that downward diaphragm pressure and multiplying it massively, but you aren't allowing any release.
So instead of a gentle water balloon stretch, you're firing a cannonball of pressure straight down into the pelvic organs.
Yeah, you're just slamming the top of the soda can down. And to cope with this, people end up developing these unconscious compensation patterns. Physical therapist Diane Lee actually highlights two major dysfunctions in the clinical data. The first one is chest gripping.
Oh, I feel like I see this one all the time, especially when people are super stressed. How does chest gripping work mechanically?
So chest gripping happens when someone unconsciously prevents their diaphragm from dropping, usually because they're constantly sucking their stomach in for aesthetics or they're just carrying a lot of tension. So they end up breathing really shallowly, just up into the top of their chest.
Okay, and since the piston actions is basically frozen, what happens to the pressure?
It has to find an escape route. So it usually pushes outward against the lower abdomen. That's what creates that persistent lower abdominal pooch that, frankly, no amount of dieting will ever fix because it's a pressure issue, not a fat issue.
Wow, that is wild. And what was the second pattern she mentions?
The second one is back gripping. That's when someone constantly arches their spine to find stability rather than actually using their core.
It's like sticking their butt out, basically.
Right. And when you lock your lower back into a deep arch like that, you overstretch the abdominal muscles in the front. They become completely mechanically disadvantaged.
So because the abs are overstretched and essentially useless,
Mm.
the pelvic floor has to work double overtime just to keep the pelvis stable.
Exactly.
Okay, but I do want to push back on this a little
Yeah.
bit because if I'm picking up something incredibly heavy, say moving a washing machine or something,
Yeah.
I've always been taught to take a huge breath, hold it, lock my core, and then lift.
Right.
And there's even that 2023 study by Sembra and their team that explicitly noted abdominal bracing provides vital spinal stability. So isn't that solid block of pressure totally necessary to keep my lower back from, snapping in half?
No, it's a totally valid point. And honestly, it's why this topic is so incredibly confusing for athletes and just everyday gym goers alike. You are absolutely right about the spine.
Okay, good to know I'm not totally off base.
Not at all. In fact, a really recent biomechanical modeling study from 2025 by Murray and colleagues confirmed this exactly. They found that intra-abdominal pressure, creating that rigid block by holding your breath, is actually a profoundly powerful mechanism for protecting the spine against shear stress during rapid, heavy loads.
Right, it essentially turns your squishy midsection into a solid tree trunk so your spine doesn't take the brunt of the weight.
Exactly. But here is the critical trade-off that the fitness industry just completely ignores. You are saving your spine, but you are sacrificing your pelvic floor.
Oh, I see.
Yeah, relying on that Valsalva maneuver on a regular basis sends all of that unmanaged downward force directly onto the pelvic tissues. So it's a quick fix for spinal stability, sure, but it puts your pelvic muscles on the fast track to severe and sometimes irreversible dysfunction.
Yikes. Okay, which brings us to the actual physical consequences of all this. We know the pressure is slamming into the pelvic floor, but what does that structural damage actually look like for you? Are we talking about torn muscles or stretched ligaments? Like, how does this actually impact vaginal tone?
Well, the clinical registries and urological data we reviewed draw a really clear defining line between two major physical consequences of this chronic downward pressure.
Okay, what are they?
The first one is vaginal laxity, and the second is pelvic organ prolapse, which is often just called POP.
Let's definitely separate those two because I feel like people conflate them constantly.
Mm.
According to the medical guides from the Women's Health Clinic and Kegel 8, vaginal laxity is primarily a sensation, right?
Yeah. Yes, that is the key distinction. Laxity is this subjective physical feeling of a loss of firmness and tone in the vaginal walls. The clinical term they often use in the literature is a gaping introitus.
Which basically just means a widening or loosening of the vaginal opening.
Exactly.
And the real-world impact of that isn't just clinical, it's heavily psychological and physical. I mean, it leads to reduced sexual sensation, a feeling of vaginal heaviness or dragging at the end of the day, and just a massive loss of confidence.
It absolutely is a major quality of life issue. The structural integrity of the tissue is compromised, which is what leads to that feeling of being loose. But then on the other side of the spectrum, we have pelvic organ prolapse.
And prolapse is definitely not just a sensation. Prolapse is an actual anatomical shift.
Right, it's a structural descent. So the pelvic floor is essentially a hammock that holds up your bladder, your uterus, and your rectum. When that hammock becomes severely weakened or damaged, Those organs physically lose their support.
Meaning they begin to bulge and physically drop down into the vaginal space.
Yes. And in severe cases, the tissue actually protrudes outside the body.
Wow. Okay, so laxity is how it feels. That loss of tone and firmness and prolapse is the structural collapse of the organs. But they share the exact same underlying mechanism, which is that unmanaged downward pressure.
They do. Now, to be medically accurate here, the primary catalyst for both of these conditions are usually major life events.
Like childbirth and menopause.
Right. Childbirth physically stretches and sometimes tears the pelvic floor tissues, and menopause involves a significant drop in estrogen, which physically sends out the vaginal tissues, breaks down collagen, and just generally reduces natural elasticity.
Right, but those events are basically just setting the stage. The compounding factor, the daily habit that acts as a massive accelerant, is how you breathe and lift.
Exactly. Think of it like a car tire that already has a weak, thinning sidewall from years of wear and tear. If you constantly overinflate that tire and hit potholes, the pressure is always going to exploit the weakest point. It's going to bulge.
That makes perfect sense.
Right. So if your tissues are already compromised by vaginal delivery or hormonal changes, hitting them with the daily Valsalva maneuver during a heavy squat is basically just mechanically forcing that weakened sidewall to give out.
Okay, so if holding our breath and bearing down is destroying our vaginal tone and pushing our organs downward, what is the alternative here? If you still want to work out, how are you actually supposed to engage your core?
The solution lies in a biomechanical concept called co-contraction.
Co-contraction. Okay, break that down for us.
So a comprehensive review in the medical journal Agent explains that your deep corset muscle, the transversus abdominis, and your pelvic floor muscles are neurologically wired to fire together. They are a synergistic team.
Ah, so you cannot isolate one without the other. If you're just screaming at your abs to tighten up, you are missing half the equation.
Exactly. When you prepare to lift something heavy, you really have to initiate the stability from the bottom up, not the top down. Georgia Urology actually provides a really elegant visualization for this in their clinical guides.
Oh, I love a good visual. What do they suggest?
They tell patients that as you exhale, you should gently draw your lower abdomen inward, as if you were zipping up a tight pair of jeans.
Oh, that is such a relatable mechanical cue.
Yeah.
Because when you zip tight jeans, you don't suck your breath in and hold it.
Nope, never.
You naturally exhale, and you gently draw the lower tissue up and away from the zipper. You feel tension, you feel stability, but you definitely don't feel like you're pushing down.
And the exhale is the magic mechanism there. You always want to exhale on exertion. So if you're doing a heavy deadlift or a squat, you exhale as you push up from the bottom of the movement.
Because exhaling naturally forces the diaphragm to lift back up into the chest cavity.
Exactly. And because the whole system is connected, that upward draft naturally draws the pelvic floor up and in. You're literally using your breath to counteract the downward force of the weight.
That's brilliant. So instead of fighting the pressure, you're riding it upward. But what if that coordination is just totally gone? What if that tire sidewall is already bulging and a listener is already dealing with laxity or prolapse? Do they just, cancel their gym membership?
Oh, definitely not. Heavy lifting isn't strictly forbidden at all, but you absolutely have to modify your movements to manage the pressure.
What kind of modifications are we talking about?
Well, things like traditional sit-ups, heavy planks, and high-impact activities like jumping rope naturally generate massive, unmanageable amounts of downward force. So those are the first things you cut. Instead, you focus on pre-activating the core.
Like gently lifting the pelvic floor, sort of like stopping the flow of urine before you even initiate a heavy movement.
Exactly. Give the organs support before the load even hits them.
And if someone just can't feel that connection anymore, the sources do outline specific physical therapies that are clinically proven to rebuild that exact synergy. The Journal Agent review actually highlights two really fascinating methods. The first one is hypopressive exercises. I had never heard of this before. How does it actually work?
Oh, hypopressives are incredible. They essentially use your breath to reverse the downward pressure. The technique involves a specific posture and what's called an apnea breathing technique.
Apnea, so holding your breath.
Kind of. You exhale all the air out of your lungs, and then you perform a false inhale, meaning you flare your ribs and expand your chest as if you're taking a huge breath, but you don't actually let any air in.
Oh, wow. It's like putting your thumb over the top of a straw and pulling it upward. The liquid inside gets sucked up because of the pressure change.
That is the exact physics at play. By expanding the rib cage without letting air in, you create a powerful vacuum, a negative pressure zone inside the thoracic cavity.
And that vacuum mechanically pulls the resting diaphragm upward.
Yes, which in turn literally drags the pelvic organs and the pelvic floor upward along with it. It takes all the weight and strain off those tissues, and it trains the resting tone of the pelvic floor to sit higher.
That is wild. You're basically using a vacuum to fight gravity.
It's super effective.
Now, the other therapy mentioned is DNS, or dynamic neuromuscular stabilization. And this one looks at how babies move, right?
Yeah, DNS is based on the idea that we are all actually born with perfect core mechanics. Think about a healthy 6-month-old baby lying on its back.
Okay.
It can lift its heavy legs up in the air, reach for a toy, and stabilize its spine perfectly without doing a single crunch or holding its breath. Babies naturally expand their abdomen 360 degrees when they breathe, which creates perfect intra-abdominal pressure.
So they use the entire soda can completely naturally.
Exactly. But then we grow up, we sit hunched over desks for 10 hours a day, we get stressed and start chest gripping, and we suck our stomachs in to look thin.
We basically unlearn our own biomechanics.
We really do. So DNS is a clinical rehabilitation approach that retrains your central nervous system to find those fundamental infant-like movement patterns all over again.
Reteaching the brain how to coordinate the diaphragm and the pelvic floor automatically.
Right, so you don't have to consciously think about zipping the jeans every single time you pick up a grocery bag.
Okay, it really sounds like the ultimate takeaway here is that if you feel heaviness, dragging, or a bulging sensation in your pelvic region after a set of squats or a run, that is your body waving a massive red flag.
A huge red flag, yes.
The pressure has overwhelmed the support system. You have to back off, reset your breath, and stop treating your core like this rigid block of wood.
Right, because proper bracing is not just an elite athletic secret. It is a vital, everyday life skill.
Whether you're lifting weights, carrying a toddler on your hip, or trying to rebuild your body postpartum.
Exactly. Protecting your vaginal tone requires respecting the piston. You have to modulate that internal pressure, not maximize it.
Modulate. Don't maximize. I love that. But before we wrap this up, there is one final, deeply provocative detail from the research stack that completely blew my mind.
Oh, this is the best part.
It really is. It comes from a 2014 study by a physical therapist named Holly Tanner.
Yeah, this was definitely the most fascinating anomaly in all the data we looked at.
So Tanner was conducting a study involving 50 pregnant women in their third trimester. The doctors needed to assess these women for pelvic organ prolapse using an ultrasound.
Okay.
And to get a clear view of any prolapse, the doctors explicitly instructed the women to bear down, to perform a Valsalva maneuver, because mechanically, pushing down forces the organs lower, making the prolapse visible on the screen.
Right. They were given a direct verbal medical instruction push down.
Exactly. But the results defied the instructions entirely. When asked to bore down, nearly half of the women subconsciously co-contracted their levator ani muscles instead.
And just for context, the levator ani is the main deep muscle group of the pelvic floor.
Right. And even when the researchers used visual biofeedback training on a screen, literally trying to teach these women to relax their pelvic floor and push the pressure down, a significant number of them simply could not do it.
Their bodies just refuse.
They actively fought the conscious instruction to bear down. By automatically tightening their pelvic floor, their nervous systems were essentially hiding the prolapse from the ultrasound, basically protecting the organs from the pressure.
Which leaves us with this profound question about how we view our own bodies. I mean, if our pelvic floor is so hardwired to reflexively protect us to the point where it will subconsciously fight against our conscious verbal instructions to bear down,
Right.
how much of our everyday pelvic tension is actually just an unconscious guarding mechanism?
Seriously. How much of that tightness, that pain, or that dysfunction are you walking around with simply because your body is constantly bracing itself against a world of mismanaged pressure?
And you just haven't learned how to let the breath back in yet.
It's definitely something to think about the next time you hold your breath.